Welcome back to another episode of Complete Human Performance Radio. I am one of the many hosts we have rotating through this show now, Anthony D'Orazio, and today I am very happy to be joined by Dr. Quinn, medicine woman. Quinn, how are you doing today?
Thank you so much for having me. It's a true privilege and pleasure to be here. I'm doing great. Sunny and beautiful Florida. Not much can go wrong here. Except for maybe
We
hurricane
normally
free.
Yes. Normally, I would, being here in Ohio, I could complain about the weather, but today was actually gorgeous. It was like high 60s, low 70s, and sunny. So we had great weather. So we both had great weather today, both in good moods. This is very solid. So Quinn, we having you on because you have your doctor of physical therapy, and you work with some very high end athletes. If you could, why don't you tell our listeners just a little bit about your background and what you're currently doing?
Absolutely. So, my background academically, I attended the University, Point Loma Nazarene University in San Diego. I majored in exercise science. I then attended your alma mater, Duke University, go Blue Devils,
One of my alma maters, yeah.
where I received my doctorate of physical therapy. I graduated in 2011. Um, and then I kind of have an unconventional path to where I landed, but I took a job in outpatient orthopedics, and I would almost exhaust the challenges in certain areas that I was. And then it was time to move to a new space just because I wanted to keep learning and expanding my skill set. But I had a dream that was written on my heart in the sixth grade. And I told my parents at a very young age that I wanted to be a physical therapist and I wanted to work in professional sports. And I remained steadfast to that dream all the way through sixth grade, high school. My mother encouraged me to go into undergraduate undeclared so I would at least keep my options open. I told her, okay, I want to be a physical therapist or an attorney. I took one law class. It just didn't evoke a passion within me the way the
Right.
exercise science classes had. And I declared my major right after that class and I'm born and raised a California girl. Love where I grew up, love where I attended undergrad. Back to that very focused and determined sixth grader, I actually picked my undergrad when I was in the third grade. I think I was heavily influenced by my babysitter. um, but I visited North Carolina and absolutely fell in love. To this day, I still love North Carolina. And while I was there, I had the privilege of having one of my internships be with the Duke football and basketball team, where I got to learn from the very knowledgeable Dr. Nick Potter. And that really set me up to have a focus towards sports. But again, like I said, I went into an orthopedic clinic. And then I returned back to North Carolina to work at the University of North Carolina and did a residency there in orthopedics. After that, I moved out to Oregon and took a job in Eugene, Oregon, at an incredible sports facility, Tensegrity Physical Therapy. And I can look back on every single place that I worked as to what it taught me professionally, the skill sets it gave me to make me successful where I am today. But it was in 2011, I sent an email to the WTA and just said, I don't have experience. I'm not looking for a job. I'm just curious about what you look for in candidates. How can I strengthen my resume that I could ever be a candidate to be a physical therapist at the WTA? And I got one email back in 2012, and they recommended a sports or orthopedic residency. 2014, I entered a residency program. So I emailed them back just saying, hey, I want you to know that I've pursued this. Um, but I was still had another year to complete. And then in 2016, when I was working in Oregon, they reached out to me and said, and we've had a position come available. I thought of you. Send me your resume if you're interested. And they'd sent me the job posting, and it definitely had some qualifications that I did not have. But I figured the answer is no if you don't apply. So I applied, and next thing you know, I am in my seventh year working for the Women's Tennis Association. And I will absolutely say it is my dream job, and it's actually been exceedingly and abundantly more than I could have thought to ask for. It's an incredible opportunity.
That's awesome. I haven't heard that story, so our listeners, I was hearing it for the first time as you were. That's incredible. I like the sort of persistence with not only going from sixth grade till your current professional life, but also just sort of the persistence of reaching out early. Because when you first reached out, it's 2011. You didn't get the job till 2016, right? It's a 5-year process basically to for where you wanted to, where you thought you might want to work and where you ended up actually working there. Um, so it's incredible. What once you got to the WTA and you start working with these athletes, what was your sort of initial impressions of going from working with probably athletes or just people that are maybe more I consider myself and most other people that are listening probably more sort of lay individuals or weekend warriors. What was the major difference you saw in sort of transitioning to professional athletes?
Ooh, great question. So it's a big transition, and I remember my boss saying most people do not start to feel comfortable in this position. They call us PHCPs, primary care providers, until year two. You have to complete 2 full years, and then you'll start to feel competent, is how they explained it. And I'm telling you, at the 2 year mark on the dot, I was like, oh, wow, I actually understand this job now. Um, there is so much, it's a massive amount of information. It's such a unique environment. And it's been such a blessing as a clinician because it's expanded my skill set into a way more holistic approach because of the things that I have at my fingertips. So I think a big difference from the population that I was treating previously, which was high school athletes, college athletes. We had a semi pro soccer team that we worked with, but a lot of weekend warriors and individuals who wanted to stay highly active. Well, if they're having pain when they're running, I can remove running. I'm allowed to remove that stimulus so that we can then go back to the mechanics. I can introduce cross training, and then I can build it up to where they're able to execute that task with a gradual load progression. You get into this environment, and it's how what can I do to modify the amount of pain that you're in so that you can still compete, because it's only through competing that you get paid. Tennis is an individual sport. There is not a lineup that we can select from. There is not somebody that, oh, will you substitute for them? No, if you're injured, you withdraw the tournament, that moves somebody else in, you don't get paid. And obviously, there are other ways that athletes make money. They have endorsements, they have tournament appearances, um, expeditions, bonuses, but a lot of it is prize money. So if you don't play, you don't get paid. So I'm now thinking about the monetary aspect for them. Okay, how can I make sure that you're fit to play, safe to play, and aren't just going to go out there, play a couple points, and then retire, because that's disrespectful to the tournament. So we take into account the athlete, the tournament, what is best for them. So if somebody has, if you are just a weekend warrior tennis player and you have pain with serving, probably going to modify what you're doing, but still give you the ability to go hit or play. If you are a professional tennis player, we are going to be exhausting every single option to see how you can play and still play at a very high level. And so you take in the entire comprehensive look of, okay, what has been done, what works for you. Again, we work with a tournament physician and can get prescription medications. Um, we can a lot of taping. You might see, if you watch tennis on TV, you'll see that some girls have various tapes on them, um, again, what can we provide you with so that you can make it through that match and on to the next? Obviously, we do have injuries that the athlete cannot continue to play. And then that becomes a whole different approach. But I think that's one of the really big differences is the amount of pressure of like, how can I get you to compete at the highest level, even though we have like these niggles, which it can be very kinetic chain at that point. So, and then dealing with the compensatory patterns once they finish the match.
So, so this made me think of a question. So when if let's say I am, I'm obviously I'm not, don't identify as a woman, but let's say I was one of your client, athletes, and I'm having trouble serving. Are you actively like in some cases sort of sitting with the athlete and having them try different serve patterns to see if like certain, tweaking certain mechanical approaches changes their pain behavior, their pain pattern, or is it more? So I guess the question I'm asking is: it sort of you looking at how the athlete's moving and changing things in some cases, or is it, do you rarely do that?
No.
So, Quinn, we just had a small technical difficulty there, but we're back. So we were having you discuss if you watched the athletes in motion or had them sort of try different things, with their mechanics to see if things you could alter their pain behavior and patterns, and you were answering that question.
Yes, again, great question. We work with Dr. Ben Kibler. He's an orthopedic surgeon, or was, but he's also a researcher. And he is an expert in the overhead athlete. He works a lot with tennis, but also with Major League Baseball. And we complete serve analysis. So we take video. It's all because we're at such a unique environment that constantly traveling, we can't set up some 3D tracker yet. Technology is in our favor. But we record from various angles, and then we have a template. We call it the 9 nodes of the serve, to where
Okay.
you break down the serve starting at the foot position, the knee position, the pelvis, how it rotates, how it translates, thoracic rotation, scapular alignment, the cocking angle, and you basically give them a yes, they do this, no, they don't do this. And if they do it, they get a point. If they don't, they get no points. And you will see the efficiency of the serve. It's based upon like, how are you making the body most efficient with the way that you position yourself. So, for example, I had an athlete who had repetitive lateral hip pain. She kept getting TFL or glute med tear. So, watched her serve and could see exactly why she kept getting this injury. Met with the athlete, recorded the videos, did the serve analysis, met with Dr. Kibler to have him, if he had any other insights or feedback, met with the athlete and her coach, because you have to bring the coach into this dialogue, because that's where they're going to be practicing this. You recommend, again, no athlete wants to change their entire serve. They've been practicing this all their life. So, especially trying to convince them to change something in a tournament, I have had some athletes latch on and they're like, absolutely, we're going to modify this because the pain is so bad. I need this. So it's also figuring out to match their serve analysis with what you're finding in the training room. Can they not rotate because is it hip? Is it pelvis? What's their thoracic doing? So you're taking into account your objective assessment, you're combining it with a biomechanical assessment. Then you're meeting with the athlete and their coach, and you're just going to make 1 or 2 modifications. So for that athlete with the lateral hip translation, she's translating over the baseline with her hip because she's doing a lean instead of a rotation, to where she can take her thoracic with it and start to generate more power. I'm going to move her foot, because if I can move her foot where she has to put weight into that, move it back further, she's going to have to rotate because the foot's already there. So making those small modifications, combining it with, so we did the slight modification to the serve. She starts to feel more comfortable in that, more confident, less pain. Also, you can tape an athlete to where it's almost like that little tactile cue Where for
Right.
her, if you tape there in like a stretched position and she starts to feel that, it's that I'm tapping on that side. Like you're loading this too much, you're going to feel this after. So we do serve analysis, we do various stroke analysis. If an athlete is not moving as well on court, again, watching the way that they decelerate, the way that they cut, the way that they land from their serve. That's another thing. If somebody's like, oh, I always have this pain when I'm landing from my serve, show me. Like, let's watch a video of it to see how you do it in competition, and then let's like show me what you're doing in practice. We have like I have gone out to the courts with athletes before just to have a better assessment of it, especially if you're working on the serve with the athlete and their coach. If you have the freedom, which you don't always have in the training room because it's such a busy, most popular area at a tournament, um, it's nice if you can go out and have that eyes on the athlete with the mechanics. But yes, we really try to take all of that into account.
Do you find that these, kind of coming circling back around to the sort of differences between these professional athletes and us sort of normal athletes or more everyday people that aren't professional athletes? Do the professional women that you work with, do they latch on to the sort of changes faster, or are they able to like you sort of for hey, I want you to do this, move your foot here so you can rotate better? Do they seem to come to that a lot faster than the typical average person, or is it sort of similar amounts of time, or does it really variable in either case?
I think it's really variable. We have, I would say, our athletes, they love learning. So if you can teach them more about the reasons why, not just tell them, but show them the differences. Hopping back just to the mechanics, we also have to give them exercises to train into those new patterns so that they can actually utilize them so they don't compensate to the path of least resistance, especially when they fatigue in a match. You're going to resort to your old patterns. So, really important that we train them and strengthen them in those areas. But I think it's really, now going back to the question you had just asked, I think it's really specific to the individual. Some athletes are so curious about every area that they can improve upon that if they're seeing that this is a constant space of breakdown, then you really can maximize that moment to educate them. Other athletes, they've been doing this entire thing for what, 15, 20 years. Um, it will require a different approach to really be able to modify something. So I think a lot of it is the how you present the information, who you bring in, really getting the collaboration. If they have a fitness trainer, if they have their coach with them, if they have a physio, making it a collaborative effort, making sure everybody's on the same page. Our priority, simple, it's the athlete. But we need to take into consideration safety, health, and performance. And sometimes the athlete is so focused on performance and we're forgetting about the health over here. We need to get back to the health. So I think it's great that we can have such a dynamic approach with the athlete and who is traveling with them, or if they are traveling alone, um, making sure we present it in a way that is most easily digestible to them, that they can then apply it to the court and see the value.
Do you is how hard is it to integrate with an athlete in their team, right? So I mean, it's one thing if I come to you in a PT clinic and you'll say, hey, this is what's going on with me, and you're like, all right, we want you to do these things, and you explain why, and I'm like, okay, you know, is the dynamic a lot different when someone's coming in there and they've got their coach there and their physio or their strength trainer? Is that something that takes some skill to work around, or is it in most cases sort of everyone's on board with okay, this is what's best for the athlete?
Again, it's very unique. I had an athlete one time come to me who she had her whole team with her, not with her in the room. Thankfully, the training room is athletes only. But she
Okay.
came to me and she had an issue and wanted to talk with me about it. Great. I addressed it and then she's like, okay, will you now talk to my coach? Yep, I have a private one on one with him. He's like, hey, I need you to talk to the fitness coach. I say, great, bring him down. I then meet with him and they're like, okay, now can you get on the phone and talk to her physio at home? Awesome. I'm happy to. So I love collaborating with teams. And I think the best way to do that is to really have that rapport with the athlete. It really is about them. I don't want to be the only person on their team. I want to make sure we all have a universal goal. I've had other athletes who it's the coach that approaches me and says like, "Hey, I know you guys offer serve analysis. Can you do one on her and then like can we all talk about it?" Yeah, absolutely. Other times it's I've had physios come to me, "Hey, we want a second set of eyes. Would you come in on a co-treat with us?" Absolutely. So you see that it can come through various aspects of the team, but it's bringing it back to that universal goal of, all right, what's best for the athlete and how can we carry that out? So the nice part is like our team is so consistent at the tournaments. Like the athletes will always see the same friendly faces that represent the WTA. And there are times the athlete's like, "No, we've been on the road for the last 2 months. My coach actually just went home. It's just me." And so you get to, like, you're the consistent factor. And you get to collaborate with them to whatever degree they need, which I think is really special.
That is very cool. Do you? How much do? I mean, again, I'm sure the answer here is it's very variable, but it's worth asking. I think. Yeah, how much pushback do the athletes tend to give when when there is an injury where they really shouldn't be competing, right? And you're the one that has to tell them, "Hey, in my opinion, like I really recommend you not play, or I'm going to disqualify." I don't know what sort of level of autonomy you have to just say they can't play, but whatever level you have, right? When you tell them that you're either uh, suggesting strongly that they don't play, or you're straight up not allowing them to play, do you tend to get a lot of pushback from that? I mean, you talked about how this is what puts food on the table for them.
Mm-hmm.
So I'd imagine there is, from an athlete's perspective, there's a huge incentive to try and be out on the court, even if it's just, I'm going to go lose this match. At least then I still walk away with a paycheck.
While there are rules in place so that they can't just walk on and retire, because the fine could be heavier than what they would take away. So that is addressed in the rules aspect of it. Um, I will say there's not much pushback. It's rare. And we have two things on our side. We have an against medical advice, which is basically a legal statement that the athlete would have to sign that we would say, "Hey, we don't recommend that you play because of this injury." And it's never a life or death injury. It's just recognizing this injury is significant and this injury could get much worse if you choose to play. So that could be like a meniscal tear, that could be um, a grade 2 muscle strain where you're like, you're not, we wouldn't consider you fit to play. So there is the sportsmanship aspect, but this could and has a high probability if you play at your normal capacity to make it worse. So if they say, "I understand the risk, I want to accept it, and we know this is not life or death," then we can implement the against medical advice. They sign the statement, done. We do have a physical incapacity rule to which, if you recognize that the situation actually could be life or death, you've identified a very significant thing either on court or prior to, and you tell the athlete, "You cannot play." You have to have, and this decision's made by the doctor. And as I always tell the doctor, if you're taking away the paycheck of that athlete by doing this, you need to have substantial evidence as to why it is unsafe for them to play. Because you always have to think about the legal aspect of that. But I would say in my 7 years, knock on wood, I have not ever seen a physical incapacity rule implemented because the athletes identify the risk and are highly intelligent and don't want to take on something that could be so dangerous.
What is the worst injury that, without sort of picking an injury that was like so everyone talked about, maybe that so everyone would know who the person was, but what is the sort of worst injury you've seen an athlete play with in your time with the WTA?
Play with,
Or top two or three?
play with, or retire with.
Both, actually. I'd hear both.
Um, well, play with, I would. actually say it's normally an ankle sprain, like a significant ankle sprain where you get out there and it's already the size of like a golf ball, um, like immediate effusion. And I have witnessed athletes persevere to finish the match. They're not moving as well as they should, but it's it's also an injury I've seen a lot of athletes like unable to continue to play with. So I've seen it both, but I would say normally like a severe ankle injury, not just like, oh, I twist it and like I can hop on it and it's fine, but like you get out there, it's immediate effusion, um, and they are not moving great. Um, I probably can't say the one that has forced retirement just because it was so public.
Okay.
Um, to where
That's fine. I didn't want to. I don't want to put anyone on a spot or anything. But
it
yeah,
was
no, it's
very
crazy.
apparent who I was talking about. But yeah, there have been some. I mean, we've had ACLs on court, which is a traumatic injury. But yeah, no, there's
What would you? Is that what you would say? What would I guess? Here's a question I think you probably could answer. What would be the sort of most common injury that you see that has led to retirement?
thigh strains.
Future Anthony here with a bit of a correction. Dr. Quinn here is answering the question, what is the most common reason athletes retire? Actually, the answer to that question is illness. She has let me know offline. The question she accidentally answered here is, what is the most common reason that her team is called to court to help the athletes? So in that case, it is thigh strains. All right, after that clarification, back to the interview.
Like
Not an answer I would have expected, I'll be honest.
thigh strains. Um,
Is that just because of the sort of the stopping forces you have to continually
the
apply
lateral movements.
on the court?
So if you think about the tennis as a sport, about 70% of the movement is lateral, 20% is forward, and 10% is backward. And with that amount of lateral movement, think about our surfaces. We do hard court, we do clay, and grass. They all play very differently. And you'll have athletes who will slide on hard court. I do not know how they do it. Um, but watch clay. The French Open will be in end of May to June, and watching them slide, it's like they're on an ice rink. They just
Yeah,
keep
yeah, definitely.
sliding. So you think about the eccentric demands of like, well, and then the concentric, because if you're sliding and then you got to change direction, it's like ice skating, break, stop, go. So I would say a lot of thigh strains would be what we get more of and it's, I mean, the grade ones you'll see the girls play with, but we've had some significant ones, absolutely.
Do you see a big difference in injuries between the three surfaces?
Oh yes, of course, of course. um on grass, because the ball bounces lower, you have to get a lot lower, so you're going to start to see a lot more knee stuff. um Clay, because the balls get heavier because they pick up the clay, you start to see a lot more shoulders. Obviously, you start to see a lot more of the adductors as well. Hard court, um, it also depends upon the location. So we definitely track injury trends, but think about it, an athlete who just played in Miami is playing at sea level the next tournament, Bogota, Colombia. I think they're at 8,000 feet elevation. So
Right.
balls will fly there. And so you're going to start to see a lot more upper extremity. Um, it's very interesting how like the swings go and the injury trends that you'll start to see amongst the athletes. I think we get a lot of our ankles on hard court, but also on clay, because as you're sliding, if if the shoe just hits ever so slightly,
Catches,
yeah,
yeah.
right over. Um, Also on grass, you'll start to see, because they have to get so low backs. As they start to fatigue in their legs, they'll start to compensate in their spine. So yeah, it's every every tournament's a little bit different. Gotta take
No, it's. I mean, it makes sense. It's just. I guess I don't play tennis, so I don't know the differences between the courts. But it makes perfect sense. All the stuff you said. It's like, oh yeah, I would. If the ball's lower, I'm leaning over, so yeah, my lower back, my knees. It's crazy. Like, I mean, I get. I mean, it makes sense given you're not playing one game. You're playing potentially for hours and doing these repetitive movements. That fatigue is going to be kill. Like, so I hear that. I guess that's a question. How, given that you said you track injury trends, like what percentage of injuries are happening in the final? So women, it's 3 sets, right? Is the
Mhm,
max? If I remember
mhm.
right. Like terrible. I don't understand why the numbers are different between men and women for some
Well,
reason, but they are.
this is the thing.
Uh,
It's only different at Grand Slams. Every other
yeah, so only
in the
some of them.
year is 3 sets for men and 3 sets for women. But at the Grand Slams, it is 5 sets for
The first
best
of
of
men.
five, and best of three for the women. But I think what's so crazy is, unlike any other sport, like, how long is on the clock for basketball, for NHL, NFL. You go out to a tennis match, the fastest match I've ever seen was 36 minutes. And the longest I've seen was like 3 hours, 40 minutes. But I think it was 2011. There was a 4 hour and 44-minute match. And you're just like, think about that. The, the discrepancy of, they say an average set will be about 45 minutes. And for most athletes, that's pretty true. But you'll have these outliers where, okay, you played 3 hours today, and then tomorrow they play another 3 hours. Um, it's a very unique sport to prepare for.
How trying to tie that to what your role. So how does that variability do you feel most directly impacts your interactions with the athletes? The fact that they don't know exactly how long, does it affect, if it's, I guess, yeah, I guess I'll just leave it that way. How does it affect your interactions with the athletes?
It definitely does. So I think what's easiest. So we see athletes for match prep. We also see them post match for recovery. We see them for rehab. We see them for preventative. But specific to like a competition day for them, the only time an athlete actually knows when they're going on is when they're the first match of the day, or if they're the night match and they've seen that the match before finished with adequate time. Other than that, they're just watching, and you can watch the momentum of a match. So if you know that you're the first match at 11, training room opens at 10, you're there, you get your prep, whatever you need, your match tapes, you get your salted drinks ready to go, you have everything you need, and you're out the door. Then you'll have athletes who are watching their match and they're like, okay, I'll go in when there's one more set to go. And then they see, oh my gosh, the momentum has changed so much. Like, I'm going to be on in like 10 minutes, and you're like racing to get them all prepped and ready. Or they're like, okay, I'm next on. It looks like it's finishing. And then they wait another hour for it. So I would say, for us, the training room is always open. So it doesn't impact, like, we know we're going to be there when they need us. I think it's probably really challenging. And again, they're the professionals. So they start to know, like, okay, that girl, I kind of can recognize her patterns as to how long she would play. Again, you don't know every single one because they have the wild cards and they're new up and comers, but these girls know the timing of things. You'll see some of the younger girls, you kind of have to start to teach them the timing so that they're not just racing in 5 minutes before their match frantic, because nobody needs to go into court with already having that anxious energy because you weren't
Right.
prepared. So we definitely have like training room practicals. It's lessons of the training room, and we teach them, especially the new girls, of just like how to prepare, what to do, and how can we help them. I think for the athletes, a big challenge is timing of your fueling. So if you see a match is going quick and you're like, okay, I've eaten at an adequate time. Oh, now they've just split sets, and that last set was a lot longer, and I ate 2 hours or 3 hours ago.
Right.
So I think that's where it becomes a lot more challenging for them of like, oh, now I have to warm up. I warmed up, they split sets. Now I have to wait and warm up again. So, from my perspective, doesn't really impact me. It's more of just the education. And if I know, like, I will look at the schedule for who's coming in the next day. If I know, like, okay, this girl's, she always comes in and she always gets her feet taped. This girl, she's going to need ankle tape. We'll have that stuff ready because we want to be the quickest, efficient part of their preparation. We don't want them to, like, be frantic about what happened in the training room. It's a place of peace. So, we just get it ready as out the door onto your next warm up, talk with your coach, talk to your mental coach, whatever you need to address. So it doesn't impact us too much. I would say the longer it gets into a match, especially in a hot and humid environment, that's when it might impact us if we have to go to court because US Open's a perfect example. Super hot and humid in New York, early September, and you will start to watch the patterns that girls demonstrate when they start cramping on court. And we know that we're going to get called just either on standby or like, is this going to turn into a type of heat illness condition? So again, watching those trends, being ready of like, hey, just so you know, like court 11 is at 3 hours and 15 minutes. That might be a court that we need to be close to when they finish.
Gotcha. Gotcha. What do you find is the most rewarding part of working with these professional athletes for you personally?
Ooh. I authentically love what I do. I I love my colleagues, and I love the athletes. I think it is such a privilege to be in close proximity to them, um, because you get to play a very small part in guiding them in safety, health, and performance. We get to be the voice of health for them. I think this is true for athletes and non or for professional athletes, but also for those weekend warriors, or anyone training. But be sure to assess every area that can be a potential weakness. What areas are not being addressed that could hinder or limit performance? And I think it's exciting to discover that for the athlete because we have such a vast team of professionals where if I have a dietetics question, we have a WTA sports dietitian who I can immediately do a telehealth consultation with if an athlete was having dizziness on court because she's improperly fueling. We have a hydration specialist. Again, if we have an athlete who has repetitive cramping where she's like, I'm doing all the things, I'm adding the electrolytes, I'm drinking so much water, I'm making sure I have sport drink, and I'm still cramping. Okay, then we need to go to the next level. We do sweat testing, we do urine specific gravity testing, and we try to give them as much information so that when they're on court, these areas are addressed. We have a whole mental health and performance team, composed of counselors and psychologists that travel with us to the tournaments where they do performance training, so like the mental fitness of being on court. They also can address other areas of stress or improving sleep. We have, again, radiologist, dermatologist, cardiologist, internal medicine physician, orthopedic. So if there are questions, obviously we have the tournament physician, but if an athlete's at home and they're like, hey, I'm having these issues, can I get a second opinion? Yeah, of course. Give me the images. We'll get those uploaded, send them to the doc, and then they get a whole comprehensive approach. It's not just, okay, so we have an athlete out with an injury. All right, well, I'm going to have you meet with the dietitian. I'm going to speak to the physio that you're working with. I've already sent you the plan that is written out for you week by week with the goals of what needs to be achieved to progress to the next one. You're going to work with one of our mental health care providers to work on visualization and being out with an injury and how we can continue to progress in our game despite not being on court. You're going to work with your coach, assessing videos of what have you been doing well, what are areas you need to work on. We're going to have you work with your the physio at home will be doing like your rehab, but what is your strength training like? Do you need to have a program provided by one of our strength and conditioning coaches? What it's addressing every little area. And I think that is exciting because you never know what you're going to discover and then how that can lead into improved performance. So I think that's what's really rewarding is finding those areas that have yet been uncovered and then getting to guide the athlete of like, look, let's help you with this.
Have you seen? Obviously, you don't. I don't want you to give specific names. But have you seen cases where someone's like a new to the tour, right? And presumably, well, like I can't imagine where these athletes have the access to that sort of support system before they get to the tour. So have you seen instances where someone comes to the tour and all of a sudden they make a pretty big leap because all of a sudden they start addressing all these other areas that they didn't realize they were maybe not maximizing their uh, output from?
Well, I think it's the small changes over time that contribute to those giant leaps. Um, I don't think it's I think it's the small investments. It's like what we spoke about earlier is getting the buy-in so the athlete understands the value. But with every athlete, because they are so unique, what worked for one is might not work for the other. So it's taking that whole athlete into effect um, and starting to build that case around them. I don't think I've seen like, oh wow, we did this and just like massive. But I can think back to um, an athlete last year where we addressed strength and conditioning, we addressed stroke analysis, we addressed consistent rehab, and I've watched her ranking just trend upward. And you're like, that's beautiful to see where it's all due to her. She put in the work, she's made the changes, the coach was super open to it, and that is rewarding to see of like, oh, they utilize the services and look at that trend. So equally I think you can say to some athletes they have established what works for them. And it is a little bit harder to make some of those changes. But again, I think it goes back to the relationships that you build with every athlete. Having that rapport is, I mean, true of in the clinic or in the training room.
So, in a previous episode of this podcast, spoke with Dan Gardner, and he talked about working with top end athletes, and he called them the great compensators because they're able to compensate for maybe the best, not the best movement patterns, are not the best, something, whatever. It could be eating patterns, sleeping patterns, whatever. Would you say if you could sort of describe how these professional women athletes are different than the average, if there's sort of one or two things that you say are like fundamentally different about them, or patterns you see compared to like us everyday athletes, what might you say they were?
Patterns, are you talking? Can you elaborate a bit on the question?
So with Dan, I was struck because he used the term great compensators, so that when he works with some athletes, he'll notice that, like, for example, maybe their diet is not so great, but they're able to perform at such an extremely high level. For them it doesn't matter, right? And obviously, yes, once you start to dial it in, they like can perform even better. um, but the thing he's noticed of these professional athletes compared to the average athlete is the average athlete you can't get away with as much, right? You have to be,
Mm-hmm.
you know, strength training has to be on point. Your endurance, your aerobic work has to be on point. Your, specific technical work or skill work has to be on point, right? And if all those things are good and your diet's on point and your sleep's on point, you're an okay athlete, right? You're okay. Whereas for a lot of these top end athletes, again, for the people he's worked with at least across a variety of sports, was that okay? You barely work out. You barely go to a weight room. Yeah, you might do a lot of aerobic work, right, for whatever you do, right? Maybe your skill work, you do a lot of work there. But your sleep, and it doesn't. They aren't necessarily doing great with sleep or this, and that they're still able to compensate for that. They get injured, they can compensate very easily by using you talk about shifting patterns and loads, right? A lot of these athletes can get away with it a lot more than a sort of typical athlete can, in his opinion, right? Whereas if my back, if I tweak my back doing something that requires my back, I'm not I'm not going to have the ability or probably the physical ability to sort of compensate with like using a slightly different movement pattern. Have you seen anything like that in your work, or do you feel like everyone's so different it doesn't really apply?
Well, I think it's kind of like the more you play, obviously, the more you're playing at a tournament, it means you're winning. So I think it can either be in the length of a match or in the length of a tournament. Those areas that might not be addressed will become uncovered. So, or if you are losing early, again, there's no research to back this up, but that would be a question I would pose is if you are losing early, what are the areas that are not addressed that could be improved upon? So I don't know if I would call them great compensators. I think you can just see that those who have really taken that holistic approach of are doing the sport specific strengthening. They are focused upon the diet. They're eating to fuel well. They're getting their sleep, what's appropriate for them. They're making sure that they're hydrated. They are focusing upon recovery after the match. They're investing in their rehab. They're seeing that their physio on a regular basis, even if they're not injured, to have the assessments and make sure what's my alignment, how I'm doing that spot that we were previously treating. Would you check that out? Would you check my mechanics? And of really examining all of those, you're going to see that those athletes are going to be playing longer. So I would almost say it weeds them out, because only for so long, those will be exposed if you are not
Right.
eating well, if you are not sleeping well. Like talent, absolutely. These girls are so talented, but it's having that talent and then wanting to foster it by addressing every single one of these areas. And so I think some of the girls who are very talented, if they're not addressing those other areas, my question would then be, well, how deep are they playing? What is the pattern to which, what round are they getting to? And that can be a question that I pose to our data scientists, but I haven't asked that before. But it's definitely a curiosity.
Yeah, you can do a correlation between sort of amount of visits or time with your team and sort of average round you go out on.
Mm-hmm. Yeah, we hired a data scientist, and these are questions that we are starting to really investigate, which is exciting from my perspective. Because what we learn there,
Oh,
we can start to change and implement in the training room, and then we only increase what we can give to the athlete. So I love that new aspect for us and implementing new
I
technologies. I really see that we're in a very um, exciting posture where there's a lot of growth that can really happen in our training room in the upcoming years.
that's very exciting. So I think I know what your answer is, but I feel like I should ask it anyway to get it explicitly stated. If there's one thing you could sort of tell the average listener of this podcast, so someone that's interested in sort of being athletic and, you know, doing athletic things that they could take from these high end women athletes, what would you tell them?
What do you think I would say?
I would think you would say repeat what you've emphasized a couple times, is sort of taking a holistic approach to both health and fitness, right? And sort of making sure you're looking across everything you're doing, right, across your life, really, right? What you're doing. When I go eat, I actually have to go train after this. But what I do with my training, what I do with my eating, right? I haven't slept well all semester because I'm too busy, right? Like, so I know my training sucks right now because I know my sleep is bad. Um, and that also affects my diet because when you're not sleeping, you tend to snack, right? I'm as guilty as anyone of falling into these traps. Um, but taking a more holistic approach and knowing sort of making sure you're kind of at the very least keeping an eye on all those things, and trying to do your best in each of them is what I would say you would answer.
You absolutely nailed it. Um,
See, I can pay attention.
I would say train specifically for your goal, strength train, um, in my previous clinic, I would always say, you don't run to get fit. You get fit so you can run. So strength training, I think, is so important to every single sport, whatever you are doing. Sound nutrition, make sure you're fueling your body adequately. Hydrate for the activities at hand, proper hydration. Implement proper recovery practices. This is definitely an area that I can improve upon. Mental skills. The mind will always defeat you before the body will. Assess your mechanics, whatever you're doing. Try to do it properly. Have somebody else assess your mechanics. Um, Invest in rehab, in prevention. I'm a physical therapist and I pay to go see a physical therapist because I'm like, I know I need it. I can't treat those areas of myself. Like you said, sleep of the utmost importance. I say this to all our athletes. Have you done your yearly blood work? Blood tests provide insight into health status. I live in Florida, like we discussed, and I'm out in the sun every single day. I did recent bloods and I was vitamin D deficient. And I was like, well, I didn't expect that one. But
No.
because being outside all the time, I'm like, there's no way I would be. Sure enough, I'm like, okay, we're going to start with supplementation. We're going to make sure that we're really getting fortified foods that have vitamin D in them, making sure we're getting all of our egg yolks and all of those things. But you don't know what you don't know. And so I think it's really becoming curious about what areas am I not addressing in my training, or what area am I lazy in my training? Is it like, for me, I'm not gonna lie, I don't enjoy stretching or mobility work. So that is, I don't,
No one does.
uh, those who go to yoga do. And I am like, oh my gosh, I stretched for the first time this year and got so excited and proud of myself. And so those areas, okay, well, then get curious. Why do I need to focus on mobility? Why should I be stretching? If I can find value in an answer that actually like clicks with me, okay, then you should implement it. So I think it's, yeah, what I preach to our athletes is, let's look at every area and then let's go from there. Because and another one, I guess, is, I would have to say, equipment, because we do equipment assessments for the athletes, and we do, even on the road, we do orthotic fabrication. So what, like, is your equipment working for you or against you? And for a runner, I would say your equipment's your shoes. How long have you been in them? um, how often do you replace them? How'd you pick that shoe? Why'd you pick that shoe? What does it do for your foot type? What injuries do you have that could potentially be related to that shoe? So it's, again, just looking at the whole picture, exactly what you said.
Very cool. Well, Quinn, if our listeners wanted to follow you on social media, how could they do that?
I am Dr. Quinn, Medwoman, but I think it's Medwmn. I don't know, I removed some of the vowels in there.
Uh, they'll find you. And there'll be a link. I'll put a link to it in the episode description so you can find it there as well. Anything else you'd want to pass on to our listeners?
um, oh golly, that's good. No, I would just say, kind of what we started the podcast with is like, if you have a dream, whatever it may be, like as cliche as it may sound, but start gathering the information about it. Get curious about it. Don't be lazy in your training. Don't be lazy in the pursuit of your dreams. And reach out to those resources. Reach out to those people who are doing what you're doing and learn their story. So I think mentorship is so valuable. And yeah, use all the resources you can. So thank you again so much for having me. I feel so privileged to be on. Yeah, it's been a treat speaking with you. And I apologize for the
Yeah,
technical
it's been a
difficulties.
no, not hopefully not too bad. Well, it was great having you on, Quinn. If you're interested in following the CHP, you can follow at Complete Human Performance on the Instagram machine. You can follow me, not that I post that often, at Durazio Anthony. We will see you next time.